Hello and welcome to my channel. My name is Jazzy RN. I have been a remote utilization review nurse for over 9 years, and the goal of my channel is to help nurses pivot from the bedside to remote work. This company is called Allscripts, and they are looking for a nurse practitioner remote in Australia for the weight and men's health. And a little bit about Allscripts. We're on a mission to make good health last a lifetime. More than 1 billion people live with obesity worldwide. Driving preventable chronic diseases, we're here to build better long-term care. Just a FYI, I work remotely in the United States. I don't have any other ability to work outside the United States. I'm just going to give that disclaimer before we get to the requirements of the job. So first, I always go to the requirements to make sure I do fit the requirements before applying. So about the requirements, you must be a qualified health professional. You are a qualified nurse practitioner with AHPRA registration without restrictions. You have a passion for telehealth and primary care, demonstrated experience in primary care conditions, and telehealth experience is a big plus. You are tech savvy. You are confident in navigating digital applications for clinical practice. You are an experienced decision maker. You make timely and accurate referral decisions based on your clinical expertise, and stressful situations don't faze you. Trust. Patients trust you implicitly because of your experience, your confidence, and your manner. Clear communicator. Communicating with patients, health professionals, and team members comes natural to you. You get the message across clear and concise and heart. Patients love their interactions with you, feel safe and supported in your care, and keep coming back. Cerner is hiring a telehealth nurse. This is Health Direct. It is Melbourne, Victoria, Australia. But if you look here, it says work from home as a telehealth triage RN, and it is Australia-wide. It is 24/7 national service. Now, I did find this job originally on LinkedIn. Whenever I do my filtering for jobs, I make sure I always filter remote. And for some reason, it says on-site here. And the job was reposted 4 days ago, and only 71 people clicked apply. So this actually kind of basically is in your favor if they put on-site instead of remote. Just make sure if you ever see something like this where it's on-site or hybrid, read more into the job description. If you just scroll down, you'll see it says work from home as a telehealth triage RN. So back to Cerner's website, the first thing I always look at is the requirements to make sure I do meet the requirements. And this is a role, a part of our partnership with Health Direct on the 1800 Medicare line, supporting their mission to deliver accessible, high-quality healthcare advice to every Australian. And they are offering either a fixed-term contract, which is 20 to 38 hours per week, until the 30th of June 2026, with potential extension, or a casual contract, minimum of 20 hours per week with the option to pick up additional hours. They provide you information about what you'll be doing, the hours of operation, and you'll have 4 10-hour shifts. It's 24/7 inbound service, rotating roster provided fortnightly, availability required across days, evenings, nights, and weekends. Set shifts are available for full-time candidates between the hours of 3 p.m. and 8 p.m. You have 7 days of paid training, paid online training, and you must have full attendance for these 7 days is essential. This is a very short training period for just 7 days. I've been working remotely for over 9 years, and the training is at least maybe a month and a half for the jobs I've worked in the United States as a utilization management nurse. So this is the requirements you need to actually work for Cerner. You are an RN with unrestricted AHPRA registration, 3+ years. You have 3 years full-time or equivalent, recent experience in acute, ED, primary health, or rural or remote settings. You have a strong clinical judgment and remain calm under pressure. You are confident navigating digital systems, CRMs, and telehealth platforms. You have a private home space, reliable Wi-Fi, and strong mobile reception. And you can work 24/7 rotating shifts, including days, evening, nights, and weekends. And here are the CV requirements whenever you are applying. They want to make sure as part of your application, please ensure your CV includes the following details so we can accurately assess your clinical experience. You want to include your weekly hours or FTE worked for each role. For casual roles, a statement of service or an outline of your average weekly hours and your employment dates in month, YY format, that's month and year format, that's 2-digit. An application that don't include this information may experience delays in processing. So just make sure if you are applying for this job, you fill out your CV requirements directly as specified here. Fresh Clinic is hiring for remote medical directors and nurse practitioners. Now, this clinical training position is not remote. It is for a nurse, but this is the only clinical position on their website that is not remote. These two are for doctors, they are remote, and these two are for nurse practitioners, and they are remote as well. Just an FYI, if you go to the description box below, you will see a link to my website with over 70 companies that hire nurses to work remotely. Now, most of these companies are based out of the United States. That's where I live. There are some companies here that are based in Australia, Canada, the Philippines, etc. So if you actually go here to look for jobs, if you want to look outside of just the using LinkedIn, you can try this website as well. Also, if you scroll to the very bottom of this little list here of companies, you'll see a link to Reddit and Glassdoor. There's some pretty interesting threads here about remote work and remote nursing, as well as if you go to Comparably and TeamBlind and Fishbowl, you want to do your due diligence on these companies prior to applying, or if you just want to apply and then look up the information about the company to see how they rank with their current employees, you can go to Glassdoor, Reddit, Comparably, TeamBlind, and Fishbowl. I also have a link here to my Udemy course called Remote Nursing, The Cure to Bedside Burnout. And this link here is a list of different office essentials you can use for your remote job. This one right here I use every day. So this is a seat cushion, and it is a memory foam. It is terrific whenever you're working 8 hours and you're working sitting down, as well as if you need to get a mat for your desk, either for the floor or for the carpeting, so on and so forth. And in the very bottom, there is a FAQ with a list of over 20 questions regarding working remotely. Now, I work remotely as an insurance nurse in the United States, but some of these questions and answers may apply to you as well. So back to the Fresh Clinic's remote job. This is for a nurse practitioner, and they're looking for a nurse practitioner in women's health. This is remote in Australia. And the first thing I always do is go straight to the requirements just to make sure I meet those requirements prior to applying for the job. So for this position, this is about you. You're a values-led clinician who wants to make a meaningful difference. You combine clinical excellence with warmth, empathy, and strong ethical judgment. You are confident balancing autonomy with safety and want to be part of a team that raises the standard of virtual preventative healthcare in Australia. So what you'll bring is an AHPRA registered, unrestricted as either medical practitioner or nurse practitioner. They want you to have 2+ years of post-registration experience in women's health, midwifery adjacent, sexual health, fertility, and primary care roles, strong working knowledge of MBA telehealth guidelines and safe prescribing principles, high comfort with digital health platforms and remote clinical workflows, a communication style that is warm, clear, and culturally aware, deep respect for all patient autonomy and long-term health outcomes. And the bonuses are if you have experience in obesity management or metabolic health, background in dermatology or hair restoration treatments, and prior telehealth or virtual care experience. Now on to the next position, which is telehealth GP or nurse practitioner. I'm going to go straight to the requirements of the job. And this is basically the same exact requirements as the previous job description. They do want you to have experience in primary care, women's health, metabolic health, chronic disease management, or dermatology, They also want you to have strong working knowledge of NBA telehealth guidelines and safe prescribing principles like the previous job. And just a FYI, just make sure whenever you are applying to these jobs, you want to focus on what you did, why it's important, and how it applies to the job that you want.